Welcome to an account of my persistent pain journey, which I'll narrate mainly through the use of pictures. At the end of this patient talk, I hope you'll be able to understand why patients seek greater person-centeredness in evidence-based healthcare, the ingredients of a good clinical encounter from a patient perspective, and the importance of providing patients with understanding and skills they can use beyond the clinic door. There are 6 areas I aim to cover. I'll describe my persistent pain journey and share my thoughts on both routine and person-centred evidence-based healthcare and how they've worked for me. My persistent pain story began with a manual handling injury 11 years ago. It was the summer of 2008 and I'd been clearing out the loft of an old Victorian house. It was a Saturday morning when the pain started. It began as a niggling pain in my right leg. It was annoying, but nothing too bad. However, the pain began to grow, and by lunchtime I instinctively knew I was in trouble. I was in a great deal of pain, and the pain was progressing quickly. By early afternoon, I was experiencing severe pain in both my back and my legs, and I could barely walk. I took over-the-counter pain medications, but they had little effect. The pain was absolutely excruciating. The severe pain continued the next day, and my husband called out a GP. Armed now with stronger painkillers, I was optimistic the pain would resolve and I could return to work the next day. However, Monday morning saw no improvement, and if anything, the pain was worse. I was almost totally unable to walk, and I was in urinary retention. I phoned 101 for advice, and they called out an ambulance. This was the start of my evidence-based healthcare for my persistent pain condition, which for a number of years proved narrow and largely ineffective for me. I stayed in hospital for 5 days. I'd been admitted largely because I was in urinary retention and there were concerns I could have Cauda equina syndrome. Cauda equina syndrome is a rare disorder that is usually a surgical emergency. Thankfully, this was ruled out by an MRI. I was told that a disc in my lower back had prolapsed, but there was no nerve root compression. This later proved to be wrong. The radiologist's report was inaccurate. 6 weeks later, when a rheumatologist viewed the same MRI scans, he showed me that my L5-S1 nerve root was being compressed and a part of the disc had broken away. Unfortunately, my hospital experience wasn't the best. Looking back, I view much of my hospital care as paternalistic. I didn't feel a valued partner in my care and I wasn't sufficiently well informed, or to be honest, in my view, sufficiently well cared for. On the day of my discharge, I wasn't even seen by the discharging doctor. I was discharged from hospital with little idea about what my condition was or what I should do about it. I felt cast adrift. I was discharged from hospital with a variety of pain medications, including liquid morphine. I remained in excruciating pain. I could barely walk, was unable to sit down, couldn't dress myself, and was unable to stand long enough to shower. I was in a great deal of difficulty and distress. The pain medications weren't helping sufficiently, and I was finding it difficult to recover from being discharged from hospital by the doctor with no discussion. I didn't know where to turn for the help that I so badly needed. My pain was invasive and it affected every aspect of my life. Following discharge from hospital, it took weeks before I could walk much further than a few metres, and much longer before I could sit for a few minutes. Despite these difficulties, I quite quickly returned to work. I was fortunate that I was well supported and allowed to work flexibly. I tried to live the best life that I could, but I was struggling. I needed strong pain medications to get me through the day, but the side effects were making me ill. I desperately needed support. For the first 17 months of my journey, I was treated conservatively. I was given powerful pain medications, injections and physiotherapy. I understand that conservative treatment is often tried first in the hope that patients will sufficiently recover from a disc prolapse without the need for surgery. For me, The suggestion and then decision to perform surgery was made at 15 months post-injury, which seems an extraordinarily long time to wait. I still don't understand why my healthcare professionals took so long to decide that conservative care wasn't working well enough for me and that I needed surgery. Looking back, I think all the signs were there that I would need surgery many months before. Throughout these 17 months of conservative care, I was trying to continue to work, even though I was taking strong opioids, including morphine, and even though I was in a great deal of distress. I was asking for help from healthcare professionals, but the help I was receiving wasn't working well enough for me. I was seeing a number of healthcare professionals during these 17 months before surgery, and I do wonder if a lack of coordination of my care and a lack of information sharing between clinicians was at the bottom of why my conservative care continued perhaps longer than it should have. I wonder who was supposed to be overseeing my care to ensure that decisions were made in a timely fashion. This wasn't evident to me. I believe good sharing of information amongst clinicians and good coordination of care to be vital components of good evidence-based healthcare. In terms of quantity, I was receiving a lot of healthcare support. In terms of effectiveness, I'm not so sure. My back surgery took place around 17 months post-injury. I had microdiscectomy and decompression surgery. I was told by my surgeons that my back surgery was technically successful, but unfortunately I continued to experience pain and numbness. Following a repeat MRI, I was told by my surgeons that there was nothing more that could be done for me. I was diagnosed with failed back surgery syndrome, a term that I hate. I was told that my compressed nerve root wouldn't recover and that my neuropathic and back pain were likely permanent. They were right. I have continued with neuropathic pain, sometimes severe, and my latest MRI shows a sciatic nerve root that is visibly shrunken and tethered to the disc. I'll never know when my permanent nerve root damage occurred. I'm guessing it was a gradual process. I will always wonder whether if my surgery had happened earlier, the permanent nerve damage and the resultant pain I now live with could have been less. Understandably, my emotions were strong at this time. I grieved for the life I'd lost, and I was fearful for my future. I just couldn't imagine how I could live with pain for the rest of my life. This was beyond my comprehension. I was fortunate not to become clinically depressed. I can certainly understand how this can happen. I danced at the door of the pain cave, but thankfully I didn't go fully inside. Following surgery, I continued with a range of interventions from a range of professionals. I continued taking pain medications, including strong opioids. I was placed on a spinal cord stimulator pathway, but after 2 tortuous years of assessment, I eventually declined the option of a spinal cord stimulator. I decided the risks outweighed the unknown benefits, and I was tired of feeling my life was on hold. Throughout my journey, my pain clinic input was minimal. My appointments were merely a precursor to injections or for spinal cord stimulator assessment. I didn't receive multidisciplinary pain clinic care. I wasn't given any pain education input or offered other treatments such as acupuncture. I received a reasonable amount of physiotherapy care. Prior to surgery, I received 2 episodes of physiotherapy care. In the year following surgery, I received 2 further episodes of care. All 4 of these episodes of care held similarities. They all resulted in what I would call routine treatment. Although they were delivered by 4 different therapists, they were all very similar in nature. I think most of these episodes of care involved teaching me some simple anatomy, most involved some manual therapy, most involved a home exercise program, most involved medication advice, and 1 involved a group exercise program. I'm sure the care I received was similar to the physiotherapy care given to many, maybe most other patients with a similar diagnosis. Most of the physiotherapy I received had limited success for me, partly I think due to an overemphasis on core exercises. Although I was being given some basic advice during the physiotherapy sessions, I didn't really understand why my body was constantly in pain, what the triggers for my pain were, and what the realistic outcomes for me were. Like many others, I was brought up to do whatever a doctor or other healthcare professional asked of me, without question. I was fundamentally a passive patient. There was nothing in my upbringing or in my experience of society's approach to the medical world to suggest I had shared responsibility for making decisions about my healthcare. I entered the physiotherapy consulting room as a passive patient, with a subconscious expectation that I would be told by the physiotherapist what to do. I had no real idea what a physiotherapist did and how they could help me. I had no idea about the different methods physiotherapists use, and I had no idea what I needed to do to get the best out of my care. I was conscientious and undertook the minimal exercises I was asked to do. Reflecting back on those sessions, I suspect those minimal exercises weren't ever going to be effective enough to make the large physical improvements I needed to make, but I didn't realise that at the time. I'm sure my passivity and lack of awareness meant my healthcare was less effective than perhaps it could have been. Outside of physiotherapy, I was determined to improve my situation, and I did what I could to help myself get back to being able to walk and manage independently. I received no professional help or guidance with this. It's obvious to me now that I could have asked my physiotherapist to focus their support on improving my ability to walk again. I could have asked for consideration of walking aids to use short-term to help. I could have asked for help to increase my independence overall. I didn't need to try to do all these things on my own. I was fully blinkered in terms of doing what was suggested to me and not asking for or expecting anything further. I was an unequal partner in my care. I subconsciously expected my physiotherapist to take the lead and for me to blindly follow. Unfortunately, none of these 4 episodes of physiotherapy care proved effective enough for me. They were as ineffective as a scarecrow. I wasn't given much, if any, help to improve my day-to-day physical function, and I wasn't taught pain self-management. I wasn't helped to walk again or to sit. I'd developed many maladaptive movements. For example, I frequently stood with all my weight on my left foot and leg, and I sat leaning on my left side. I was trying to alleviate the pain on my right side. My lopsidedness and the maladaptive way I was holding and using my body was ignored. Despite my pain being predominantly neuropathic, I wasn't taught much, if anything, about neuropathic pain. Nobody taught me about the complexity of pain. I expect that most of these episodes of therapy care did have some short-term benefits for me, but I don't think they had any long-term benefits. I don't think they improved my day-to-day physical function. I don't look back and reflect on what I was taught in these therapy sessions or apply any learning to my everyday life. In my view, these episodes of therapy care were routine and weren't sufficiently person-centred for me. The approaches used may have worked well for others, but overall, they didn't work well enough for me. Eventually, just over 4 years into my persistent pain journey, I received an episode of physiotherapy care that was much less routine and much more person-centred. This episode of care was quite different to any I'd experienced before and was my turning point. The physiotherapist was Matthew Lowe, and his focus was much more on me as an individual, both in terms of my presenting physical symptoms and condition and the person who I am that they manifest themselves within. With Matthew's help, I was able to break free from some of the chains of pain and disability. I became better able to live life well with persistent pain, and overall my pain reduced. Following this life-changing episode of physiotherapy care, I self-managed my pain reasonably well for a number of years. I chose to stop taking all regular pain medications and decline the option of a spinal cord stimulator. Unfortunately, though, gradually over the following years, my ability to self-manage my pain gradually declined, and eventually I decided I needed to seek further professional support. I was fortunate to be able to be re-referred back to Matthew. It was nearly 10 years since my injury, and around 6 years since I last saw him. At the time of my first referral to Matthew, I continued to experience high levels of pain and disability. I was trying to continue to work and get on with living my life, but there remained huge obstacles for me. I remained in constant and often severe pain. Emotionally and physically, I was struggling to cope with my situation. I could walk a reasonable distance, but sitting remained painful and problematic. My sleep remained poor, and I was experiencing often high levels of emotional distress. I wasn't depressed, but I was finding my situation difficult to contend with. I was no longer able to tolerate opioid medications. None of the medical interventions I'd received thus far were working for me. I struggled day to day. In terms of medications, although I was still taking regular non-opioid medications, I'd become so sensitive to opioids that it was becoming unsafe to take them. I'd collapsed and needed to attend accident and emergency following a very small dose of oral morphine. The side effects of opioids were too great for me to continue their use. A little while ago, I discovered a note that I'd written just before starting with Matthew, which perhaps give a flavour of the difficulties I was going through at the time. This is part of it. I found it very difficult emotionally to come to terms with my situation. I've had to live with constant pain, sometimes severe, over the last 3 years, and I've lost my career through it. In many ways, the biggest emotional impact for me has been and remains the thought of facing the possibility of, say, another 30 years in constant pain, some of that severe. It's usually when I talk about the future of my life in pain with doctors or physiotherapists that I dissolve into tears or fight back tears with them. I found it difficult to stop fighting against my physical situation in order to work full time and accept that if I want to live a life without significant severe pain, then I actually have to totally change my lifestyle and work plans and work part-time, with much of that work taking place at home and not in a workplace. This has been enormously difficult for me. The main help along the way has been the severe pain which has occurred when I've tried to work outside from home, and has strongly reminded me that I can't cope with a life of frequent severe pain and everything that comes with it in terms of strong painkillers and their side effects and lack of sleep. Even now, a good dose of severe pain reminds me that I have to continue to alter my work and lifestyle. I've had to cope at times, amongst other things, with not being able to walk, not being able to sit, not being able to drive, and not being able to hold and look after my grandchildren in the way that I would have wanted. And to be honest, to live with what has often been very severe pain for an extended period of time. I've not had a single day pain-free for over 3 years now. I continue to struggle emotionally with whether to live a life on more regular, strong painkillers that could make my life more pain-free, but which would carry long-term risks and would leave me living a life in the land of the fairies, with other side effects such as chronic constipation. I doubt I get the balance between pain and the use of painkillers right. In fact, I know I don't. I've struggled with anxiety regarding any hospital procedures. I'm a nervous and anxious patient. I've had to cope with disability discrimination and worry about whether I'll be discriminated against in future employment. I've worried about my financial situation, whether I'd have to sell my house because of my employment situation, and what would happen if we couldn't pay the mortgage but couldn't actually sell the house quick enough. My standard of living has been affected by my reduced income and will continue to be affected moving into my old age pension years, as my annual pension will be much lower than it would otherwise have been if I could have continued to work full-time in teaching and get a probable headship. On the surface, I managed to continue a reasonably independent life and present to others well. I continued to work part-time. However, below the surface, I was struggling. I didn't really understand my condition and I didn't really understand pain. I had few strategies to manage my pain, and I was struggling with the emotions involved in living with pain as a constant companion and interference. I was fearful of the future. At times, I wondered if this was a life I wanted to continue with. As I went through my first episode of care with Matthew, I found that I was gradually and increasingly being encouraged and empowered to take a much more active part in discussions and decisions, and a much more active part in managing my pain condition. I felt he was genuinely interested in me as a person. Matthew looked beyond my physical symptoms, and he utilised his clinical judgment and problem-solving capabilities in a way I didn't feel others had before. He subtly and sensitively empowered me. I was skillfully supported to become a more equal and active partner in my care. As with other physiotherapists, Matthew gave me a range of exercises to undertake. However, these were much more personalised and less routine than I'd experienced before. My lopsidedness had been noted by previous physiotherapists, but largely ignored. At last I was receiving exercises to do, which corrected much of my lopsidedness. Matthew taught me to ignore conventional advice about posture and sitting, and instead to find positions, chairs and cushions that work for me. Before I entered physiotherapy with Matthew, I had no understanding about the complexity of pain. I had no understanding why my pain continued despite my prolapsed disc being corrected by surgery. I had no understanding that the experience of pain involves more things than just one singular physical body part. It's hard to believe that after 4 years of living with severe pain, and after a range of inputs from medical professionals, including physiotherapists and the pain clinic, that actually my understanding of pain, in particular my pain, and how to manage it beyond taking medications, was probably in real terms negligible. Matthew helped me to understand how everything about me as a person contributes to my experience of pain. A dynamic combination of my genetics, my past experiences, my day-to-day experiences, my emotions and my physical condition all contribute to my experience of pain. I learnt to understand how these causal factors can interact with each other and influence my experience of pain. I learnt to understand how unique my experience of pain is. Learning to understand about the complexity of pain has been hugely important for me in terms of living a life at relative peace with pain. But on its own, understanding pain doesn't reduce pain. I needed to learn to self-manage my pain. With Matthew's help, I developed a range of pain self-management skills and techniques. Matthew helped me to learn to recognise the elements of me and my life that were making my pain experience worse. For example, he helped me understand that on the days my stress levels were high, that my pain levels might be correspondingly high. He helped me recognise the impact sitting for prolonged periods was having on my pain levels. These causal factors that make my experience of pain worse, I call pain contributors. Mapping out some of these pain contributors or causal factors helped me appreciate and understand the complexity of my pain experience and helped highlight to me areas for improvement and change. Matthew also helped me to understand that there are elements of me in my life that are likely to improve my pain situation, which I call pain improvers. Mapping out some of these pain improvers, or positive factors, again helped me to better realise the complexity of pain and provided me with a focus for further improvement. I don't always track my progress in terms of improvement, or otherwise, of my pain, but sometimes it can be useful. For example, when I first started to learn pain management and I was working hard on improving my pain situation, I tracked my progress using apps on my phone. Whilst working with Matthew, I selected a number of my pain contributors and pain improvers to work on and change, and I tracked my progress. I'm a very visual person, so I developed a visual support based on Matthew's use of vector diagrams, which worked particularly well for me. The vector diagrams on this slide show the factors I identified as being the main contributors to my pain experience in January 2018, and then again in August 2018. The length of the vector gives an indication of how big a problem I felt a difficulty was at that time. My aim over time was to decrease the size of each of the pain contributors and increase the size of the pain improvers, thereby hopefully reducing my overall experience of pain. As can be seen, there were some elements I was able to change, but some that remained static. Some elements were interrelated. For example, when I reduced my workload, I also reduced my need to sit. Although there was some improvement over time, there is much more work for me to do. The vector diagrams on this slide show the change in my pain improvers between January 2018 and August 2018. It appears I was better at increasing the levels of pain improvers than I was at decreasing the levels of pain contributors. In my experience, clinicians put more emphasis on negative pain factors, but I think it's helpful to put an equal emphasis on positive factors. When you're in pain, it's far too easy to focus on the negative. Psychologically, it's helpful to emphasize the positive as well as to consider the negative. Although I appreciate this is not a conventional way of tracking pain, the use of vectors works well for me. I like identifying a small number of things to focus on, both positive and negative, and to measure them at different points in time using the length of a vector. The use of vector diagrams has supported my self-awareness, insight and understanding of the complexity of pain. They support patient-clinician discussions and shared decision-making. As physiotherapist and patient, we worked in partnership together with the aim of improving my pain and situation. I brought to the partnership my unique experience of my condition and the difficulties it was causing me, and Matthew brought his clinical knowledge, clinical reasoning, and extensive experience. In my view, the best physiotherapy care happens when the patient and the physiotherapist work in equal partnership. Each have a different set of skills and experience they bring into the partnership. Through discussion and working together, these different perspectives, skills and experience can be effectively combined to provide the patient with the best possible care. This diagram gives an indication of how the partnership worked for me with Matthew. You can see the skills and experience that we both brought into the partnership, the journey we took together and the results. I think the diagram illustrates well that if the partnership is predominantly one-sided, either side, then the results cannot possibly be as good. I believe this was the situation when I was being a passive patient during my first 4 years of physiotherapy care. My physiotherapists at that time were only aware of a fraction of my story. They were making decisions that affected me, but didn't fully involve me, and I was blindly following. Although Matthew and I worked in partnership and shared responsibility for decision-making, there were times when I took an active lead and times when Matthew did. Sometimes, particularly when I felt overwhelmed by my situation, I took a more passive role, and sometimes I took the lead. The lead changed imperceptibly between us. Through discussion and sharing of our individual perspectives, experience and expertise, we were jointly able to improve my pain and my situation. I learnt to understand and manage my pain better, and our combined efforts improved my functional skills. It's clear to me now that I desperately needed a more person-centred approach right from the start of my journey. I'm convinced that if my care had been more person-centred, that I could be in a very different place right now. Even if the permanent nerve damage couldn't have been avoided, then I could have been helped to live well and better manage my pain and condition right from the start. I'm sure that I could have been spared a great deal of suffering and also a lot of medical interventions. The therapeutic alliance is the bond between patient and clinician. It's how the patient and therapist connect, behave and engage with each other. I cannot overemphasise how important it is to me as a persistent pain patient to have a strong, supportive therapeutic alliance with all of the healthcare professionals involved in my care. These are my reasons. I need the confidence to be able to raise things that are important to me, but that I am concerned might be seen as silly by others. If I can't, these thoughts don't go away. If I can, and they can be discussed in an open, non-judgmental way, then I can be supported to better understand. I need to feel that I'm listened to. My story as a persistent pain patient is hugely complex, and I need the confidence that my healthcare professional is interested and can pick out the relevant points for expansion. I don't want him or her to just sit there and listen to me. I want to have a genuine, mutually respectful conversation. I need to feel that I'm an equal partner in my care. I need my therapist or clinician to take the lead at times, and I need him or her to let me take the lead at times. I need to feel that I'm not just being done to, and that me as a person doesn't matter. I need to feel that I'm being treated as an individual with a unique presentation of my condition and set of psychosocial factors. I need his or her explanations of what might be happening with my body, and I need to feel able to discuss how that fits in with my lived experience. I need to be able to understand the possible causes of my pain experience and how to manage it. I need to feel able to say when I don't think their hypothesis about my condition is right. I need to feel able to trust my therapist or clinician, so I feel that any exercise or other treatment proposals are worth trying. I need to have enough faith in their judgment to put the required hard work in outside of the clinic sessions. I need encouragement, and I need to want to try hard at whatever I'm asked to do. Chances are it may not be easy, but having faith in my healthcare professional means I'll be able to persevere. I need to have my successes, however small, positively reinforced. I need to be able to openly discuss without judgment my failures. I need to have treatment options explained in a balanced way. I need to think that when discussing, for example, surgery, that I'll be told both the pros and cons and that I won't be led when making a decision. I need to think I'm being given the same advice that my healthcare professional would give a family member. I need my healthcare professional to be sensitively honest with me. Living with persistent pain is difficult and at times confusing. It's difficult to be able to step back from your situation and to see things objectively. I need my healthcare professional to help me do that. I need them to understand me well enough to be able to help me do that. There's no doubt in my mind that if I'd had my time again, I would take a more active role in my care right from the start. I would enter all my episodes of care as an active and more equal partner, taking shared responsibility. Sadly, I can't turn the clock back, but I can make this change going forward. I'm not a typical patient. I'm not sure who is, if I'm honest, and I don't want to be viewed as part of a cohort of patients with the same diagnostic label, for example, prolapsed disc, sciatica, or low back pain. There is no patient the same as me in the world, and there have been no research trials carried out on me. I have other comorbid conditions, and my social, genetical, biological, psychological, and other circumstances are unique to me. There is no research that can give an accurate prediction of my outcomes with any particular treatment option. Although I do want research evidence to be utilised as part of the decision-making in my care, I need it to be considered in a realistic and balanced way. I need my narrative to be listened to and for my individual presentation and circumstances to be centre stage. I need to be empowered to play my part in genuine shared decision-making. I need good person-centred, evidence-based healthcare. It's fundamental to evidence-based healthcare that healthcare decisions should be made by the patients. Although I recognise that final decisions about my healthcare are mine, I prefer to come to these decisions through a process of shared decision-making. I want to have good two-way discussions with my clinician within a good therapeutic alliance. I want to be sufficiently informed. For the first 4 years of my persistent pain journey, much of my healthcare was paternalistic. Sometimes important decisions about my healthcare were made without me even being consulted or involved at all. At other times, I was expected to make important decisions, sometimes with potentially life-changing consequences, without being given even the barest of information. I was denied the right to make well-informed and good decisions. I was not valued as an equal partner in shared decision-making. It feels as though sometimes I wasn't valued at all. I think good shared decision-making within a good therapeutic alliance is an important element of evidence-based healthcare. Evidence-based healthcare is built on the premise that I, as a patient, should be able to make properly informed decisions. Without at least adequate communication and at least adequate sharing of information, this is impossible to do. Communicating appropriately and well is a skill. Good communication is fundamental to providing good care. Communication, including sharing of information, is a two-way process. The clinician must communicate in a way that the patient understands and must share information at an appropriate level. The clinician also has a responsibility to facilitate good communication from the patient and to facilitate the patient sharing their information with the clinician. They must empower the patient. They must listen. Clearly, decisions about healthcare should not be made in isolation. Sadly, I believe the lack of coordination of my care and the lack of sharing of information between clinicians were significant factors in the failings of my care. Although I appreciate the difficulties encountered with data protection regulations and the sharing of patient data across different hospital and clinician computer systems, and of course shortage of clinical time, I'm sure there must be ways to better coordinate a patient's care than I experienced. I believe good sharing of information amongst clinicians and good coordination of care to be vital components of evidence-based healthcare. I understand that recommendations for routine treatment can come out of research trials and that these routine treatments will have been proven to work for many people. However, the research studies will also have shown that they don't work for every individual, and the research studies will have been based on a cohort of people who cannot possibly be fully representative of me. I'm unique, I'm an individual. I completely understand the need for and benefit of guidelines based on research, such as NICE guidelines, but surely that's all they are, guidelines. They're not meant to dictate care in all circumstances and for every individual. It seems to me that I was often treated as one of a cohort of patients with the expectation that routine treatments would work for me. I found that even when it must have been crystal clear that these treatments weren't working well enough for me, or that I needed more practical and functional help, so these treatments continued. Surely it must be important to maintain the focus on the individual receiving care, and before implementing a routine treatment, or simply following a guideline, to consider whether other options might be better indicated for that person. I acknowledge the system-wide drivers that require clinicians to follow guidelines, for example, commissioners, policy, normative practice, etc. But surely there must be a way to deliver more personalised care. In evidence-based healthcare, at least as important as research evidence, if not more important, must surely be the patient's own narrative, their story, their experiences, their genetics, their symptoms, their life, everything about them that is needed to make sound healthcare decisions. I suspect, but I can't know for sure, that evidence from research and guidelines carry proportionately too much weight in some decisions made by my clinicians. At least that's the way it seems to me. I don't think my patient narrative, individual presentation, and circumstances play proportionately enough of a role, or sometimes even at all. My best healthcare occurred when I was treated within a strong, more person-centred model of evidence-based healthcare, and my patient story was listened to. I'm sure that research evidence was considered, but good clinical judgment, genuine curiousness, patient empowerment, and a particular focus on me as an individual occurred. I believe listening to the patient narrative is key to good healthcare and to good shared decision-making. Evidence in evidence-based healthcare means more than just research evidence. My understanding, which may of course be wrong, is that research evidence is sometimes seen as the most important element of evidence-based healthcare. Although I understand why this might have come about, it concerns me deeply that research evidence may play too great a role in my healthcare. After all, I'm aware that not all clinicians properly understand or are aware of the evidence that is available. I'm aware that there can be two pieces of research evidence that effectively give opposing results. I'm aware that clinicians do not always have the time available to keep abreast of evidence. I'm aware that not all clinicians thoroughly read a research report, maybe reading only the abstract and the conclusion. I'm aware that there is much research yet to be done. I'm aware that not all research is carried out rigorously. Most importantly, though, I'm aware that I would almost certainly be excluded from any research being undertaken on my primary condition of sciatica, maybe because I've had back surgery or maybe for some other reason. There is no research anywhere in the world that can possibly give a fully reliable predictor of my success with any particular treatment. They may well be able to give some indications, but that is all. Although research evidence is an important element in my care, I don't want it to be viewed as the most important element, trumping all others. It is one tool in the clinician-patient's toolbox. All patients have their own unique presentation of symptoms and their own unique psychosocial factors. Reflecting on my routine episodes of care for my persistent pain, I would suggest that my treatment was not sufficiently individualised to either me as a person or to my presenting condition. Unfortunately, I had to undergo a number of similar routine episodes of care before eventually being referred to a physiotherapist who took a more individualised and holistic approach to my care. I believe that my pain and resultant disability could have been less if my physiotherapy care had been more individualised and better matched to me earlier in my pain journey. I could have been enabled to live life well beyond the clinic door much sooner. I wish I had. In summary, this is what I want for my future healthcare. I want it to be truly person-centred and empowering. Include my narrative as a vital and important piece of evidence. Involve proper coordination of my care. Be reflective with clinicians looking back at treatments that did and didn't work for me and properly taking this information into account. Involve shared decision making occurring within good therapeutic alliances. I want it to provide me with sufficient, well-balanced information in order for me to make good final decisions. Be informed by up-to-date and relevant research and by guidelines, but not dictated by them. Have a focus on function and independence. Provide me with understanding of my condition and also transferable skills so that I can build on my therapy care and manage my condition beyond the clinic door. I live with persistent pain 24 hours a day, 365 days of the year, not just when I'm within the four walls of a clinic or within an episode of physiotherapy care. I'll likely live with pain for the rest of my life. As a persistent pain patient, I cannot be and do not want to be treated by a physiotherapist or other clinician every day of my life. If I'm to live well with persistent pain, then I need to be able to utilise knowledge and skills that I've learnt from my clinical input and be able to apply it beyond the clinic door and into my everyday life. I need to be treated as an individual and be given health care that is carefully matched to me as a person and my presenting persistent pain condition. And I need the right clinician. I need my clinician to improve my self-efficacy and independence and not create or perpetuate dependence. And I need my clinician to empower me, teach me transferable skills, and look beyond the clinic door. I've been lucky. I've had my life changed through a truly person-centred, evidence-based episode of physiotherapy care. This episode of care was highly individualised and well matched to both me and my condition. I've been able to use knowledge and skills taught to me within the clinic, beyond the clinic door. Through this, I've been able to live an active and fulfilled life with persistent pain. I cannot express how important this ability to live well with pain is to me.
you.